Hey everybody, welcome to the Reaxing Neuroreactive Workshop. My name is Jeremy Strom. I'm the Director of Education for Reaxing North America. And I'm here at an amazing facility, Total Body Works in Colorado Springs. Total Body Works is really a unique place to train and to get well because they offer a broad variety of services. From high-level personal training to performance, as you can see in this room, they also provide physical therapy. Dr. Dave Bush with Cadre PT, whom you'll meet in a moment and spend some good time with today. They provide chiropractic work, ART soft tissue, massage therapy, ARP wave therapy. They have cold plunge, they have hyperbaric oxygen training. They also provide IV drips. So really a whole systems solution here at Total Body Works in Colorado Springs. Now today we're really going to focus on the idea of performance, and performance from a tactical standpoint and from an athletic standpoint. And really in my mind they're the same things, right? One, the winner loses obviously a much higher cost, but both from a brain body, so cognitive to physical, from mental to performance, and the whole system involved in everything we do. So as a quick foundation, Reaxing was really designed to provide neuroreactive opportunities and stresses in human movement and human performance. And we have a lot of solutions. We will talk about the Reaxing system the most of all. So we don't really look at, one piece of equipment covers all aspects or all modalities of human performance. We see it as a full system. And it's not just Reaxing. We have some great partners in SmartFit and Viper Pro specifically. So as we go through the day, I'm going to just give you a brief introduction to each Reaxing and SmartFit and Viper Pro. And then I'm going to have Dr. Dave Bush come up and give some strategies around kind of ground-based stuff, things that you can take home today, things that you can do today, and then how to kind of enhance those strategies utilizing the Reaxing system. So we have a great hour and a half, 2 hours. Stay with us as long as you can today because I think you'll get some good takeaways and certainly a great overview of what is possible in this new level of human performance in neuroreactivity. So I'll start with kind of the foundation of who we are. This is the Reax board. As you can see, the Reax board is a flat, stable platform, but then perturbates and moves in an unpredictable environment. It goes from 11% incline-decline and 14% side to side. So if I stand on it, you can see that it's moving me, and I would have to react or respond to losing my balance. Now, anything you can do on the ground, you can do on the board. So I can add loaded training here. I could add functional movement patterns to the board. Anything you would do there, I can do here. Really, really powerful opportunity, and you'll get a lot of really good stuff from the ankle up with Dr. Dave. So second is the Reax Run. And the Reax Run does something that no other treadmill on the market does. It moves just like the board, only it has a treadmill belt. So as you can see, it also goes 11% incline and 11% decline. So all that eccentric, decelerative movement patterns that are so important and largely cause potential dysfunction or injury, we can train that in a controlled environment on the Reax Run. It also, 11% incline, decline, 14% side to side, but it's not two-axis. It rolls, so it's not just up and down or side to side, but as you can see, it rolls, really giving some unique layers of stress and lines of shear from the big toe to the ankle to the knee to the hip, all the way up the chain. So really a fun, unique opportunity to train real life in a controlled environment. Next is the Reax Box. So the Reax Box gives us really fun kind of gamification, close quarters combat, right? So I can hit this, I can kick, I can elbow, I can knee, I can do anything. It is super resilient, and if you see the lights, it also gives me the opportunity to have to move laterally and react to the lights. We play games. We had the All-Navy and Marine wrestling teams here. We played games. They had to sprawl in between each hit. So really a fun, unique gamification opportunity for close quarters combat. Dr. Dave will give you some fun strategies around knee issues and lateral movement also. So the Reax Lift. The Reax Lift is a unique rack barbell system. And traditional, everything is Olympic size, but as you can see, this is not a normal plate, right? Our discs are filled with water, and they're super resilient. So I can do all of my Olympic lifts, I can bail and drop, and I'm not worried about damaging the discs, but it adds a layer of instability to all my movements. So as I mentioned, we have partners, and SmartFit is one of our partners. They're an interactive light system, as well as Viper Pro. So I'm just going to head over to the SmartFit Pro Trainer wall and show you a few fun things. So as I get over here, you can see this SmartFit Pro Trainer wall. And Dr. Dave will take us through some really fun gamification opportunities there. But there's 4 quadrants. It's reactive light. So the lights can change. There's hundreds of games. It has letters, numbers, symbols, and colors. So if your clients are really good with letters, then I'm going to add numbers. If they're really good with numbers, then I'm going to add symbols. And it's unique because I can do numbers by 3s, by 2s, by 12. So you have to go 12, 24, 36, 48, 60, and so on, and react and respond. But also, I can add sleds here. I can add a rope off the Pro Trainer, go to the Pro Trainer, back and forth. Also gamification, I can have 2 athletes at the same time, and they can compete head-to-head, which you know, adherence, games are the greatest opportunity to get people to do what you're asking them to do. So that's a SmartFit Pro Trainer. The other partner we use is the Viper Pro. And the Viper Pro is a really simple, interesting product. If you're not familiar, get familiar because it will really change how you can stress your clients' athletes. And Michel Dalcourt is the inventor, Institute of Motion, really a super smart human being in terms of movement. But this gives us a lot of opportunity to train odd position and create layers of stress that will transfer to the field, to task specific. So that's a quick overview of our Reaxing system. I'm going to take a quick break, and then I'm going to bring Dr. Dave Bush on, and he's going to go through strategies in each of those areas and show you a lot of good things that you can take home today, whether you have Reaxing or not, or, as you can see, enhance everything that you do with the Reaxing system. We'll be right back. Dr. Dave Bush. Thank you, sir. Grateful for you to be here today. So I'll leave it to Dr. Dave, and you're in great hands.
All right, thank you, Jeremy. So like you said, my name is Dr. Dave Bush. I own Cadre Physical Therapy and Performance. So I'm a doctor of physical therapy, and I focus on sports and orthopedic rehab. And as he described, I approach this from a performance lens. So what that means is rehab maybe on this side of the spectrum, high performance on this side of the spectrum. I try to cover and bridge that gap. So not only, like he had mentioned, not only getting you back to activity or just out of pain and send you on your way, I try to take all of my patients, all my clients from wherever they're starting to high performance. Or if they start, further down the line, still the goal is high performance. The goal is back to where they want to be or better. So I have the privilege of talking to you today, giving you some examples of things you can do, whether you have Reaxing or not, and we're going to go through each system. So we're going to start here with the box. And I want to give you some examples. So one thing that I like to use this for, so as he said, it's great for fighters. If you're a fighter, if you train fighters, if you work with fighters, this is incredible. Just from the cardiovascular challenge you can create with this, from the reactivity and the decision-making challenges you can create with this, it's awesome. So, but the example I'm going to give you, what I've used this for is a lot of different athletes. So One in particular was a football player and recovering from ACL reconstruction. So what we did is, as he was going through his rehab, we built strength, we got his range of motion back, no more pain. But again, didn't stop there. He wants to continue to compete. So we need to get him ready to compete. And what does that mean? He's got to be able to act instinctively. He needs proprioception. He needs to be able to compete at a high level without thinking about the injury he had in the past, things like that. So one of those pieces with football, with most sports, is you need to be able to move laterally. You need to be quick, and you need to be able to make decisions without that worry. So what we did with this is we utilized this for that purpose. So as PTs, we have tons of things we can do. So remove Reaxing for a second. You don't have the box. What do we do for lateral movements? We do shuttle drills where we're running, we're moving laterally, many different acceleration, deceleration drills, cone hopping drills where we're hopping from one leg to the other, we're sprinting and then stopping and hopping, things like that. Going around in circles and in half circles and all these different things, reacting to a ball drop, reacting to my voice and my command for a direction. These are all pieces that you can utilize now without any of this equipment. And we've all done it as PTs, and it's a great option, but we can enhance that option with the box. And so what we utilized is he's here now, so he's focused on the equipment. The lights come on, and so the command is you need to continue moving laterally. So he's shuffling around the box, and so he's working that lateral movement, but he is so focused on the information in front of him and making decisions on where those lights are that he's not worried about what his legs are doing. He's relying on the proprioception. He's relying on the instinct, which he will have to do in sport. And so it's incredible in that way because it makes it very functional. So we'll demonstrate this here in a second, but the nice part about this is we don't have to wait. We can scale this. All of this equipment, you can scale it from early on, more of a phase 1, tier 1 type position, to high level you're performing and we're increasing your performance. Because, and I'll probably mention this multiple times, you're going to perform how you train. And so if you're training and you're thinking so much, you're going to get out there, you're going to be stiff, right? And nobody wants that. So whether you're military or you're an athlete, that does not work out in your benefit. So this is great because we can get the mind off of the movement that we're training and create a decision-making process. So what I'm going to do is I'm going to bring John Marshall up. He is, again, the owner of Total Bodyworks, and he's going to help us demonstrate this. So John, come on up. So when we scale this, when I started using this, I just gave simple commands. Okay, so you're going to continue moving laterally all the way around, and you're going to hit every light that you see and get as many lights as possible. Okay, so we're keeping it simple, and we're just creating that new stimulus and that new command. So that's what we're going to start with John. So John, start right here in front of the box, and then you're going to move to your right, just shuffling around, and I just want you to get every light as they pop up. All right. So it's going to count down. When it beeps, go ahead and start.
What I'll do sometimes with some of my patients or strength clients, or I'll have them sometimes punch, or if I'm just trying to work on their cognitive skills, I'll have them clear it like this.
Yep. Yeah, so that's the nice part about the scalability is you can have more of a focus on the cognitive, like John's doing right now. He's really getting the lights, he's changing how he's hitting it, or we can gauge more the movement around the box. So I can say, move as fast as you can, go all the way around and just hit the lights as you're moving. Another scalability that we have with this is I can say, okay, you're going to move to your right, and then on my command, I want you to change direction and move to your left. So now we're adding another external cue of my voice that he's having to react to the lights, he's moving, but now he's also knows that he's going to get a command at some point, so he's listening for me, and then he has to make that appropriate decision as well.
What to do?
All right, go left. All right, keep moving, go fast. Move around that box as fast as you can. Keep that lateral movement, good.
Cheating a little bit.
And so we can gauge time, we can gauge, more of a cognitive challenge or more of a movement lateral challenge. There's so much versatility with this. And we can combine this with the things that definitely don't forget to breathe. We can combine this with things off the Reaxing equipment. So we can do hopping drills, we can do shuttle sprinting drills, and we can do this. We can take it up a notch. So the scalability is incredible from where we can start phase 1 all the way up to high performance. All right, John, so we're gonna move to the run. So now, as Jeremy talked about the Reax run, a lot of versatility. Again, just like the box, you don't have to be, it's great for fighters. You see the boxing bag, you think boxing, you think fighting, right? Incredible for them, but you don't have to, it's versatile. Same thing with the run. You think runner, okay, it's a treadmill, we need to use this for runners. Absolutely, trail running especially, incredible. But I utilize this a lot with my patients. So the example I want to give you is with knee pain. So if you're an athlete, if you're a military operator, and there's a good chance you're going to at some point have some sort of pain, and anterior knee pain or pain in the front of your knee is very common. If you jump, if you run, if you squat, you're predisposed to potentially having that pain. If there's imbalances, if there's deficits. So some of the things that I utilize in therapy or we can utilize off the board or off the Reaxing equipment is isometrics. So early phase 1 anterior knee pain, you want to start increasing the load tolerance of those connective tissues. One of the best ways to do that, isometrics. So we can do things like wall sits. So I won't make you do a long wall sit, but why don't you come on over to the wall, John, show a basic wall sit here. The nice part about this is once they're here, now they're engaging their quads. You've got nice pressure through the anterior knee, which is going to be great for that patellar ligament there, and increasing the load tolerance. So this is a very simple exercise, right? We can do this. Other things, so come on off the wall, John. Other things we can do is working how much range of motion that we're creating with that knee joint. So a lot of times that knee pain, it hurts when you squat. It hurts when you get into these deep ranges. Well, we can control that. Again, maybe more phase 1. Go ahead and kneel like I am, John. We can work that nice anterior shift of the tibia and really get into those ranges, and we can control this a lot with tolerance. Go up to the point of pain. Hold there. Take some deep breaths. Come out of that. Keeping it dynamic. So we can go fully isometric, or we can do something kind of in between, where I can have him moving here, I can have him hold here. Either way, we're increasing mobility in the knee and those ligaments and increasing the load tolerance there. Next, we can make it more functional. We can go to more of an eccentric type movement where maybe it's a knee extension that we're lowering down slowly under a weighted load, so then that muscle, that connective tissue, ligament are having to now control the load, and that's excellent for rebuilding that tissue and rebuilding the function there. Now, as we're working through kind of phases or tiers, it has to become more functional. It has to start working towards back to whatever the activity, sport, whatever it is. So another great option for anterior knee pain is backwards walking or retro walking. So if you've got just even a regular treadmill, it's an excellent option for you because of how you're challenging the muscle, how you're firing the quad, you're extending the knee, things like that when you're walking back. Now here's the beauty of using this treadmill. Again, like the box, it's very scalable, but we can add that cognitive piece, we can add that reactivity that we're going to get in a combat scenario or an athletic competition, where we don't want to be thinking about knee pain. We want to just be able to compete and perform. And so what this does is we can add this in, and like Jeremy had highlighted, it has lots of degree of motion, but we can control that. We can keep those degrees of motion small early on and get that benefit of the load bearing and that increased load tolerance while making the body react. Because again, when you're out there, if you're a military operator and you're moving through a room, you're not looking at your feet. You don't want to be limited by your pain. You want to be able to move. You may have to kick things out of your way. You may have to step on unstable surfaces. You may be playing soccer and the field is maybe not the best turf and it's uneven. You don't want to be thinking about that. You want your proprioceptive abilities to help you continue to perform and accommodate for those things. So not only may you have knee pain, but you have to still be able to function athletically and be able to react to the environment around you. So adding this into a simple rehab exercise like backwards walking with a little bit of external movement being put on you, it becomes significantly more functional. And that takes us just a further step towards back to performance, and that's going to carry over, you know, depending on what the activity is, to whatever that is, and get you there faster. So we'll demonstrate that with John. So John, why don't you step onto the run and turn and face this way, and hang on to these first so we'll get kind of a speed going here.
8.5 is good.
8.5, okay. Dead sprint backwards. So let's say he's very early on. Pain is still pretty high, but maybe we have a time frame. Maybe we want to get back quicker, and we don't have a lot of time to really go slow in this rehab process, so we want to add some of these challenging factors in early. So we keep the speed slow. We keep the interference slow. Go ahead and take long steps back. Really reach back with your foot. There you go. Stand up nice and tall. So you can see even a little stumble there, reaching back because the board's moving. As you train this way, again, like I said before, if you're training this way, you're going to perform this way. Your body is feeling that stumble now and logging that away. And now you're improving your ability to accommodate that type of strain or that type of input onto your body. We can always speed this up. We can always increase how much interference it is, and that's where that scalability comes in with all of these pieces of equipment. So again, you know, a military operator moving just like this, careful of that edge there. You know, this is great. Having to move out of a situation. If you're a football player and you're backpedaling on a field, this is excellent. But you fill in the blank with the athlete. Anything they're doing, if anterior knee pain, this is an excellent option for that. Okay. We'll stop the treadmill. Now, in my opinion, and Jeremy touched on it, the board is probably what I use the most. And it is the most versatile piece of this equipment for sure. There's so much implementation with the board. Just because you can be static, you can be dynamic, you can add weights, you can move on it, you can move off of it, you can have a hybrid where you're on and off of it. So there's lots of different things you can do here. So an example that I want to give you, I've recently had a soccer player here in town, and he had surgery on his ankle, broke his ankle, and so we're getting back a few things. We have to get back mobility. We have to re-engage that proprioceptive system, rebuild that, and the motor control he has around his foot and ankle to create stability, and then we have to make that functional, right? So he's got to be able to now take all of those things we've gained and make them applicable to soccer. So what we used this for was actually for him kind of that neural priming, getting the proprioceptive aspect of things working better, getting his brain communicating with the ankle that's now been surgically fixed to communicate much stronger and get that reactivity back. So we started there, kind of priming his system with the board, but we didn't just use the board, right? So a couple things off, we did manual therapy, we did some ankle mobilizations, things like that. But one of the things I really like, so you don't have the Reaxing board, here's a great option for you. So John, go into the half kneeling position just like this. We'll say it's his left ankle. And so we're what's called a mobilization with movement. Okay, so I'm going to take my hand and I'm going to put it here right on the top of the foot, right at the talocrural joint. And so I'm going to apply a glide here, and then I'm going to have John move towards me. Okay? There's little nuances we can change with this. Very simple, right? But we're working that dorsiflexion. It's a common, and go ahead and go back. It's a common part of your ankle movement that if you have surgery, if you sprain your ankle, any sort of injury there, you're likely going to lose some amount of that, right? And we need a minimum of 10 degrees of dorsiflexion just for a normal walking gait pattern. Ideally, we have, especially for a higher performer, tactical, military operator, professional soccer player, whatever, you need more than 10 degrees. You need ideally probably 15 to 20 degrees there. So you're not going to have that after surgery, right? So manual therapy, mobilizations, you're going to want to implement some of these things in physical therapy to help move that mobility along. MWMs, or mobilizations with movement, is another great way to do that. So like I said, there's little nuances we can change here. We're not just working on the talocrural joint. So that's the main joint, but your foot is probably one of the most dynamic parts of your body. So we need the talocrural joint to move well. We need all the other joints in the foot, subtalar joint, the midfoot, where all the tarsal bones are, that make up your arch and give you the dynamic movement in your arch. That all has to work together to create function. So your talocrural joint might move well, your true ankle joint might move pretty well, but your arches are really stiff. Your foot does not move well. You're going to lose dorsiflexion there. So we need to get it all moving well. So in this one position, another thing you can do, you can apply just that glide, or I can take my fingers and I can come under his arch. And so his heel's still down, and I can now rotate or pronate my hand under his arch to create that arch for him and move there. And we can scale that, and we can change how much we're doing with that just in this one position. Okay? So I can pull his arch up and apply a glide this direction and then have him move. Go ahead and shift towards me. And so sometimes you can feel differences there. You can get the response from the patient and go back. And this one I like to keep, sorry about the shoelaces there. I can keep it pretty dynamic, so come all the way in, pause, take a breath, and then move back out. And so we can do different things like that. If you're not in therapy, if you're not a physical therapist, what you can do is you can take a band and you can anchor the band behind you and loop it around your ankle, and you can do effectively the same thing. You can put, a towel or something under your arch to accommodate that hand of a therapist if you're by yourself. So there's a lot of ways you can take an MWM. You can make it something individual you can do yourself, or if you're a therapist, this is another option you can do. Instead of just doing joint mobilizations that can make the tissue sore, you can really make it more functional by having the patient as an active participant. Now, how do we enhance that with the board? There's, so come on over, John. So like I said with my soccer player, what we did is we started with some kind of neural priming. We want to get that nervous system working well. We want to get the brain communicating with the foot. So go ahead and stand right on the end of the board here, facing out. So what I asked him to do is I said, you want to think about 3 points of contact. You want to think your great toe, the outside of your forefoot, and your heel all need to touch the board, okay? And then I want you to engage your arch. So thinking about shortening the foot, just engaging the arch. So everything is active. His foot is fully engaged. And he's going to do that on both sides because the neuroplasticity of our brain, we can do the uninvolved side. We can perform an activity there. And that's going to help the brain understand how to implement that same movement or activity on the involved side. So what we're going to start with in this neural priming phase is we're going to have him do both feet. We're not going to hyper focus on the involved side. We're going to do both. Okay? So what I'm going to do is I'm going to turn the board on. And John, I just want you to stand there. I just want you to look forward and just absorb the movement of the board with your legs, trying to keep your head relatively level. So stand up though, let's start off standing. So you can see as he's standing here, his knees are bending, his hips are moving, his ankles are stabilizing. He's having to really accommodate for the movement that's being imparted on his body. I'll sit here for 2 minutes, just have him hang out here. And a lot of the feedback I get from my patients is, oh man, you know, this is hard. I feel like I'm on a boat, or, you know, things like that. And then you start to realize after about a minute, your nervous system is now primed, because they'll stand there and they're like, oh, this feels good. I don't really feel the movement anymore. They've kind of integrated what's happening. Once we hit that point, now we're really ready to move. We're really ready to change something up. So mimicking the MWM, go ahead and go into that half kneeling position like you were on the floor here. Good, and then shift forward. Now he's in that same dorsiflex position, and I don't have to do it. I could apply a glide still if I wanted to, but now I can use the board, and now he's very actively stabilizing and moving in and out of that deeper range of dorsiflexion. So I can cue him. I can slide him forward. I can slide him back out of that position. It all depends on what he needs, where we're at in the process. Okay? Now, outside of mobility, let's say we've got the mobility in his ankle that we need. So go ahead and stand up, John. We've primed it. He's ready to go. He's got good mobility in the ankle. Now we want to make sure it's nice and stable. Okay? So we've done both sides. We're going to assume at this point that everything's integrated. He's doing well. He's got good proprioception on this side, but we're trying to now bolster that with more stability. So now I'm going to have you stand just on your left leg.
I cheated.
Good. So now he's going to hold a single leg stance while the board is moving. He's going to be moving in and out of dorsiflexion. He's going to be having to stabilize laterally. He's having to stabilize at his hip, which this whole chain of joints and muscles in the leg have to work together to now, you know, if we take the example of the soccer player, they have to work together to even run, to even walk, to stabilize, to stand and kick the ball. He's got to have all of that working together. So this simple static position on the board becomes much more difficult and much more functional for him. So we're really working on the stability there. Okay, go ahead and rest there, John. So that's kind of an example, you know, from one sport. Soccer takes a lot of stability, a lot of movement. He's constantly moving, he's sprinting, he's kicking, you know, stopping, starting, all those things. So now I want to give you a totally different sport. I've had an Olympic lifter, so they're going to do clean and jerk, they're going to do snatch. So they're not going to be moving a lot like a soccer player running, but he has to now handle a serious load. Same thing, ankle issues. He specifically did not have the mobility or the dorsiflexion, but he's got to be able to come down into these deep, deep squat positions with a load over his head. So not only do we need stability in the shoulders, in the upper chest and trunk, thorax area, in the his core, his lower back, his hips, his ankles, across the board, right? So here's the versatility of the board. I can have him do a snatch position, or what we started off, if we're going to go a little more phase one. So come to the middle, John, and face me this way. Good, and I'm going to grab you a bar. So we don't necessarily need a heavy bar here, but go ahead and hold that into you're going to hold it overhead.
Great. Probably won't happen.
That's okay. We're going to do your best.
Yeah, shoulders
Okay, so he's in the overhead position, right? And then what I had the Olympic lifter do is now I had him perform that squat, because that's effectively where he's going to be catching that snatch. So, John, do your best to squat down here.
Ain't gonna happen.
Okay,
Yeah,
it's fine.
My shoulders.
Shoulders are okay. So we'll show the squat. So go ahead and squat down. So when he's in this deep squat position, he's really working his ankle mobility. He's down there, he's got the load of his body onto the ankle joint, and it's moving underneath him. So it's really kind of almost scouring the the ankle joint, and he's really having to stabilize as well, so he doesn't lose that in his arch or his ankle or anything like that. And so we can hold this here, or we can go up and down. Good. And so with the Olympic lifter, that example, what I had him doing was holding that overhead position with the bar. So he's working, basically getting that irradiation through the body from the shoulder all the way through his trunk, his abdomen, his hips, knees, all the way through his ankle. That's not his specific movement, but that will carry over to him in that catch position for the snatch exercise. So again, just the versatility. We can go from soccer, we can go from Olympic lifting, we can go from active aging, we can go from military operator. There's so much versatility with the board. We took an example of 2 different athletes, but focused just on the ankle, right? So we can do this for the whole body. We can even utilize it for the upper body. Again, on, off the board, static positions on the board, moving dynamically on the board, lots of versatility. All right, thank you, John, for being my model here for these activities. So we're going to take a quick break, and then we're going to go over to the SmartFit Pro Trainer and talk through some strategies there. All right, welcome back. Thank you for joining us. So I said we're going to go through the SmartFit Pro Trainer, but before we do that, we're going to look at the Reaxing Lift. So again, some things you may use this for. A lot of times I will use this for low back pain. You know, any athlete or anybody that's dealing with low back issues, especially if it's a stability problem. Once you have pain, that can be inhibitory. So those muscles are not going to work the same, right? And if they're being inhibited, they're getting weak. And if they're weak, they're a lot likely to be tight. So then you're going to feel that tension in your lower back. It's going to affect things. So basic hinging movements that whether military operator, whether athlete, you're going to need to get into some of these deeper positions, right? So this is a great option for that. Couple things you may work on without this specific lift system is you may grab a barbell and you may do a squat, right? So if we have a regular barbell, this is a great option, and you can, again, scale this many different ways, but you can get the patient set up and you can work through your squatting movement. You can hold isometrics at the end, which is something I really love, whether back pain, knee pain, getting an appropriate brace set, and then coming down, holding at about 90 degrees, and then coming back up. So that's a quick option that you can have. I'll set this here. If that's a quick option, you can have, for training that hinging motion specifically if you're dealing with back pain. So you may have to add some sort of movement to that in order to create stability a lot of times. So whether you're standing on a foam pad or you're, doing maybe more of a lunge versus a squat, something like that. But with the Reax lift, part of that enhancement we get with this is we have the fluid-filled disc, we have the bungees, and we have the bar. So now, when you squat, all that movement from whether it's the bungee on the spring here, moving side to side, the bounce from the bungee, or the sloshing of the fluid in the disc, you've got multiple layers and multiple angles of movement that's going to be imparted on your body. So what's going to be challenged there? Your stabilizing muscles along your spine primarily. Those are going to, the multifidi, they're going to have to work a lot harder to stabilize your spine. So we can keep it light. We don't have to load it a lot. If that's not tolerable, if they're in more of a painful state or an earlier phase, we don't have to load this too much. Or if they're in a later stage and we're just really trying to hammer home that idea of stability within the trunk and the lower back, we can load it a lot. So it just depends on where we're at in that spectrum of rehab to performance, but again, very versatile. So I'm going to have Jeremy come up and he's going to demonstrate with the Reax lift. So come on, Jeremy. Let's move this up a little bit. I think that's good. So let's go ahead and get into back squat position with the bar.
I'm going to come out, yeah?
Yeah. Good. So now he's set up. He's going to get into his position with his stance, and then what we're going to do is go ahead and do a back squat, just normal speed, nice and controlled down, and then back up. So even at that controlled speed, you can see how much movement comes from the bungee. And it's not just a perfectly straight up and down challenge, right? So that it's going to swing. So there's some circular movement in there. It depends on how much we get the discs and the bungees moving. So now a way we can scale it. So again, we don't have to change the load yet. But what I can tell Jeremy is I want you to go down nice and slow, and then I want you to explode up fast. And you can see how much. So these are lighter discs, so they kind of bottomed out onto the bar, but you get a lot more volume, a lot more movement out of that when you just change one of those parameters being the tempo of the movement. Okay, so that's one way we can do it, right? Other things that I've done with this is you can pair this with Reaxing system equipment. So I can have him doing that movement with all of this stabilizing challenge, and then we can rack the bar and we can do a squat jump. So we make it a lot more dynamic, a lot more ballistic. We don't necessarily have to do the squat jump, but.
Got it, okay, so we'll stay. So what you would do is you would have me go here,
Yes.
explode,
Yes.
and
we
now
can
I'm all primed, ready to go,
Yes.
and then come back. and I
Now
do a-
under your body weight that
Yep.
you're going to be controlling in sport, now we do a squat jump.
Got it.
So he does not have the external stimulus of that stabilization, but his body is primed for it. So less of a stimulus, more stability when he's just under his own load of his own body weight. Now, another thing I love to use the lift for is similar but shoulder stability. So any overhead athlete, volleyball player, baseball player, even basketball, you're having your arm overhead and you have to move it fast and you have to move it under a lot of control. If we lose stability there, we lose some of that movement, whether surgery, injury, tension, whatever the case may be. This is a great option for that. So again, we could use just the regular barbell. We can do different things, different types of presses. Unilateral presses are a lot, a landmine bar that's anchored to the corner, and you can do presses this way. You can really work the strength, and there's ways you can challenge the stability. But again, with this, we can really enhance it because now we can get a two-arm, just strict shoulder press and locked out at the top, and we can really get a stability challenge from that. So go ahead and grab the bar. And so then Jeremy's going to just push straight up, and I want you to hold it at the top position. So you can see how much movement happens back and forth, side to side, when he just locks the weight out. And go ahead and come back down, do another rep. So those bungees are bouncing like crazy because of how much movement we use to get the bar up. But then he's having to stabilize through the shoulders, through the trunk. So again, could be used for low back pain. Good. And you've got that anterior posterior challenge. You've got side to side. You've got kind of a circular challenge. So everything's stabilizing through the trunk and through the shoulders. And so cueing is important, obviously, but we can change that. I can tell him, focus on your core. Keep this stable, keep this tight, and then press. The motion decreases pretty significantly because he moved from a stable base. And so again, now, like the last example, we can rack this bar, and we can grab a straight bar, and we can do the same press. Or if we're further down the line, it's more sport specific. Now we can throw, we can do a volleyball set, whatever the case may be. We can do that because we've primed the system for that stabilization through the shoulder, through the trunk. So your brain is ready for that. So again, highlights the versatility of the system. We can use it for training. We can use it for specific isolated rehab. We can use it for priming and getting you ready to do other specific exercises. Tons of variability, tons of versatility, but that's one way or two ways I use the Reax lift. So we're going to take one more quick short break, and then we'll come back, and Jeremy is going to talk to you more about the system of the Reaxing equipment.
Hey everybody, welcome back. And again, for those of you who may have just joined us, I'm Jeremy Strom, the Director of Education for Reaxing North America. Thanks, Dr. Dave. I think some really good strategies. If you've been with us, you saw those. If you missed those, this will be available video, post-production after we're done today. But really, Dr. Dave went through a lot of the unique opportunities interacting both traditional sort of ground-based and then utilizing the Reaxing tools to enhance really this neural tissue communication. And he talked a lot about priming and really from a Reaxing standpoint, preparing the nervous system for performance, right, should be our first and foremost step in whatever task-specific movements that we're going to ask, whether you're military or whether you're an athlete. It really is the most powerful opportunity to create both tissue resilience and the highest level of performance. And in the intro, I talked about this, this mental fatigue being a pretty big barrier to the highest level performance. And if you think about some of the greatest athletes that we've been blessed to see in our lives, they really have this opportunity to reproduce high-level movement over and over and over again in the highest pressure situation. So if we think about the athlete standpoint, and really, for me, the tactical athlete is really a powerful opportunity to create a stress-filled environment with gamification and the opportunity to really prepare the nervous system for neural tissue communication. So we add layers. Dr. Dave spoke about it. We utilize all of the Reaxing products to neural prime the body, the brain and body communication for high performance. And then we have strategies, certainly from the sort of the sensory triad, your visual, vestibular, and proprioceptive systems, because when you think about anything that we're doing out in the world, really the inputs are the key to look at, right, in terms of programming specificity. And the visual system, obviously, we get the majority of our inputs from. So if you're walking around and I see that, I know, don't run into that or I'm going to fall down. What happens when we're in low load? What happens when we're in a contact sport and the visual or vestibular system get interrupted, right? Or what happens if you have to turn your head fast, or you have to spin around, or you have to jump off the ground and move your upper extremities in ways that you may not have trained under stress. These are some of the strategies that we can apply and really that make Reaxing very, very powerful in terms of your programming. So we talked about the Reax board, and the Reax board really is the most versatile piece of equipment that we provide. It offers both on, off, offloaded, loaded on the board. We can neural prime a movement pattern and then go to the floor for greater force production. So there's lots of strategies that we can implement. I'm just going to give a couple unique opportunities to show how and why we use this whole system. So you can utilize Reaxing in every layer, every level of your session, whether that be pre, whether that be prime, whether that be intra, whether that be post, or whether that be regenerative long after the session. So first thing we always talk about is breath, right? Because breath really gives us the opportunity to engage the core. You hear that a lot, engage your core. Well, if you ask somebody to engage their core, what does that mean to them, right? Contract my abdominals. That's not really engaging the trunk or the spine, which is very important. So we always add a layer of breath. I'm just going to breathe in through the nose, out through the mouth. Dr. Dave talked about the paraspinals, the multifidi, right? We really want to engage those. So just really quick, in through the nose. I'm going to fully express all my air. Once you feel like you can't exhale any more, go a couple of more seconds and notice how you feel from a trunk standpoint, from a spinal standpoint. So we would just add a couple of those. Now, as I mentioned, as I'm doing that, my brain says, oh my gosh, the floor is moving. What do I have to do to maintain balance, to create stability, to create a sense of, I'm not nervous here, right? My mind, my brain can act at the highest level, not worrying about anything that's happening from my waist down. That's really the power of the Reax board versus a BOSU or an AirX disc, right? Some of those unstable surfaces that we provide typically. So I'm going to get my breaths in. Then when we talk about this sensory triad, the visual, the vestibular, and proprioceptive systems, I want to make sure that all three of those are working at a high level and that they're working together. Really, that's the most powerful part, because if my proprioceptive system somehow is slower to respond to the input that my visual system saw, what happens? I got beat on the crossover. God forbid I'm out in the field from a tactical standpoint, right? So those things are where we can bridge the gap between these systems that allows for the highest level performance, whether it's tactical or whether it's sport specific. So I'm going to step off the board. I'm just going to add a few on-off body visual exercises, and this is very simple. I'm going to make these quick. Certainly reach out to us if you want more information about this, because we can provide a lot of strategies and or solutions to these. But all I'm going to do is I'm just going to use my thumb as a visual, and my head's going to stay neutral. My eyes are going to track my thumb. Wherever my thumb goes, just my eyes move. This is really great to do with the partner, because a lot of times as you move your thumb will go up, but as your eyes track your thumb, your head will follow. Or my head might follow, but then my eyes will come back to neutral before I bring my thumb there. So very simple strategy. I'm just going to follow my thumb with my eyes in varying patterns. Notice that my head is not moving at all. I'm going to go both sides. So this is just a very simple eye drill to get the visual system turned on, activated, right? Now I'm going to go off. So now my head's going to move, but my eyes are going to stay neutral to one point of contact. This can be your thumb, or I can fix on a point on the wall, right? Move my head there. And just keep that eye line in sight. From a vestibular system, I'm going to challenge vestibular with balance as well. So I'm going to just give my head a bit of a shake, and then notice, okay, how do I feel? Am I swaying, right? Do I feel dizzy? These are strategies that now challenge the vestibular system to respond and get neutral quicker. So if you notice that you shake your head and come to neutral and now I'm a little bit off balance, I want to make sure I add some of those strategies into my daily work, right? My my priming work prior to any movement. The other part is, if you do that and you come to neutral and there's no problem, now this resensory, this reweighting opportunity applies. So I know that if I shake my head and I'm fine, no problem, I can just go about doing whatever I want to do. Now close your eyes and do the same thing. And then see if you're now off balance, right? Or you feel some sway having to catch your body in space. So really powerful. So visual, most of the inputs come from our visual system. Very important that we can move our heads and not lose balance and see what's happening and then act or react, respond to whatever that is. The vestibular system, if I turn my head, I see what's there, but if I lose balance or if my brain goes foggy at that point, what does that mean? I lost in that opportunity from a game standpoint, or on the tactical side, what happens at that point? Very important that we train those. Now, the proprioceptive system really kind of gets hurt the most if you have visual or vestibular dysfunction. Because, as you saw that I shook my head, I automatically sway. I automatically lose my balance a little bit. So I've had 3 diagnosed concussions, right? So a lot of TBI challenges, both vestibular and visual, but proprioceptive for sure. So as we look at how do we interact with Reaxing products and Reaxing as a system to ensure that that sensory triad is working together collaboratively and powerfully at the highest level, that regardless if I'm sport or tactical, I can see, I can move, and I can react at my highest level to the highest level of my performance. That's what this system is designed to do. So to bring them all together, I'm going to close my eyes, I'm going to shake my head, and I'm going to try to balance on one leg and see where the dysfunction happens, right? So the first thing I'm just balancing, you see right now. Pretty good, no problems. But now if I close my eyes here, so I'm going to take away the visual first, so still got it pretty good. But now if I shake my head, right, I immediately lose balance. So what I know is my vestibular system at the moment is my weakest link, right? Now we add strategies how to bridge that gap and bring those systems that they are functioning at the highest level. So now I'm going to come on to the Reax board. And Dr. Dave prefaced this earlier in terms of sightline. When we think about tactical, and I'm going to focus a little bit more on tactical than sport performance, but sport performance as you're running down the sideline, as you're running towards the basket and you have to go off the floor and then land. With the Olympics coming right now, think about Simone Biles, right? What she does in the air, most people can't think about doing, let alone perform. Spinning her body, moving her body really fast, you think that's a visual vestibular proprioceptive perfect collaboration, and then land and not fall down or break something and have the tissue resilience to perform those movements. So ideally, I'm going to stand on the board, I'm going to find my visual spot, and if you'll notice right now, my head is going to move up and down. So you'll see my whole body, the board's lifting me now, it's moving me to the right, moving to the left. But now I'm just going to find my visual, and I'm just going to dampen, I'm just going to absorb what's going on below me. So if you think about I'm dribbling, and I'm moving down the court, or if my sight line, if I'm walking on an unstable environment, if I'm in the desert or I'm in the jungle or the mountains or wherever that might be, and I'm walking and my body is moving up and down as the ground is undulating below my feet, my sight line is off, right? My aim is never going to be true. But this gives me an opportunity now to understand in more of a static isometric position that, okay, I can move my body below me, my lower extremities, and my sight line is true, right? So if I'm on a range here and I'm firing, I know that my sight line, my weapon, is not going to move up and down. It's not going to move side to side. And so my aim is true. So those are some of the strategies that allow us to train in a unique, controlled but unpredictable environment. So that's one of the great parts about the Reax board. Now, so that would be a priming. Right now I'm getting prepared. Dr. Dave talked about priming the system and then going to the floor for real force production and high level of force movement patterns. Because what we know is if the brain is worried about balance, you're not going to produce as much force, right? That ground force reaction is not going to be as high as it would if I'm on a flat, stable surface. So we may take, I'm going to use the Viper Pro. So I may add just some simple off, odd position movements to really stress some lines that I may experience out in the field that I wouldn't normally. And some of that is if I reverse lunge and I take it to my off front leg side, right? So now I'm really loading my right side, but my right side is less stable, obviously, than my left side because I have this nice my left leg stabilizing to my left side. But my right leg is way behind me, so my center of gravity now is going to provide this instability. And I add the Viper Pro out to the side. This is going to create lines of stress. Obviously, it's static right now, that I wouldn't normally train, but that I may experience in the field or on the court, on the pitch, whatever the sport might be. Really important to add those opportunities. And from a neural tissue communication standpoint, this really gives us a great opportunity to bring in neural functional movement patterns. So I may go, if I'm going to do a lateral a lateral step with my right, but I'm shifting laterally to my left with the load, with the Viper Pro load. Again, that's going to create a line of stress through the tissue skeletal system. Now that any layer of stress that I provide is going to get stronger, right? My body's going to adapt, the nervous system is going to adapt and say, okay, I don't need to worry about that. I know I'm strong in this position. Continue forward with whatever the task is that you're going to do. So adding tools like Viper Pro to these task-specific movements really gives us a great opportunity to challenge, it's a good catch there, to challenge lines of stress. Secondly, the part about priming for force production on a flat surface. It's one of my favorite parts, and we know that if I do an overhead squat here and I sit in this position, right, this is really challenging because my ankles are everting, inverting, right, they're dorsiplantar flexing, my hips are elevating or trying to elevate to stabilize. Obviously my upper body is moving to counterbalance the shift of the board. So this really is going to light up all the tissue I need and create, as Dr. Dave mentioned, create this idea that the brain's not worried about the dysfunction at a lower level in the chain. It's going to produce force at the highest level. So if I just do a couple of those overhead squats, hold top and bottom position, right? Because we want to make sure that the joints go through a full range of motion or an unpredictable range of motion. So I'm just going to do 2. Then I'm going to hold those positions. And then I'm going to immediately go to the floor and do an overhead squat, right? That now I know my movement is going to be more fluid, right? If we think about coordinated musculature, this is absolutely going to improve that coordinated musculature. And my movement's going to be more fluid. And my brain, my nervous system is going to be less worried about potential injury because I primed it on the Reax board. So really a powerful opportunity, and a powerful opportunity to utilize multiple tools to create the highest level output. So as we think about the Reaxing system, I'm going to start on the board. I'm going to prime. I'm going to do my offloaded movement patterns. Then I'm going to move to the floor as I just did with the Viper Pro. So I went from an offloaded overhead press to a loaded overhead press on the floor. Then I'm going to get the cognitive, right? Now I'm going to get the brain reaction and lit up both from a cardiorespiratory but also from a cognitive standpoint. I'm going to use the Reax box to do this. So the Reax box, this is the cognitive. So you'll see multiple colors, but the idea is that I don't hit red. So as I'm moving, I got to move as fast as I can without hitting the red. And they'll go on and off, but if I hit the red, then I'm going to get, it's going to distract or detract points. So from a gamification standpoint, every light I hit, it's going to give me some points. If I hit the red, it's going to deduct those points away. So this is a great opportunity now to add the visual and proprioceptive and vestibular, because I'm moving side to side, I'm moving up and down, and I have to respond to what's happening in the lights. Now what I know is if I go through prime, movement prime prep, and now full system cognitive, now I'm ready to go. Any task that I'm asked to do from here on out, I'm ready. You can hear I'm breathing a little bit. That was 10 seconds. So really, all systems now are prepared to move and to perform at the highest level. And then obviously, as coaches and therapists, then we look at the quality of movement as they're doing the tasks that are needed. So really, just a couple of pieces combined give us a great opportunity to challenge the full system and create this highest level of performance in our soldiers, in our athletes. When you think about movement patterns, and particularly from a tactical standpoint, we do a lot with the military, and so this idea of sight line and the ability to fire under stress or have a true aim in mobility, in movement, in ambulation, that's really challenging to mimic in a controlled environment. So we use the Reax run a lot for this. And so I've already primed, right? I've already done my lower extremity, I've done my upper extremity, I did my cognitive, and now we're really just going to add some task-specific movement. So if you think about moving through a field, moving through the jungle, through the desert, through the mountains, whatever, through a building, not knowing what's on the floor, particularly, you know, in war-torn areas, if I have to, oops, excuse me. If I have to move and fire, sometimes I'm not always going on a flat surface forward, right? I may be going backwards. And like we talked about with that sight line and being able to keep my weapon neutral while the floor is changing, or if I happen to trip on something, if I can create that in a controlled environment but unpredictable underfoot, now that stress transfers immediately to the field, right? Now we know that the nervous system, you kick something, it's not worried about falling down. It knows that I'm going to catch myself. It knows that, oh shoot, that kind of rolled my ankle a little bit, but because I've been through these strategies, that pain's not derailing my ability to focus on the task at hand. Or if I'm walking forward and I have to turn to the right, when we talk about the vestibular system, right, is as I turn, I may still be having to walk forward, but my aim is to my right. So now maybe there's a little bit of crossover. Or I have to turn fast and come back to neutral. This allows us task-specific opportunities to provide the stress needed so that out in the field we can produce at the highest level of performance. So that's how I would integrate the Reaxing system into an overall session in terms of task-specific. And obviously, this could go anywhere you want to go, right? This could be force production, this could be agility, it could be strength, it could be mobility, stability, cognitive, mental stress, endurance, right? All of those things can be created in a very small system at the highest level that you really can't reproduce in a controlled environment. So that's a quick bit about the Reaxing system. We're going to take a quick break, and then we're going to move to the SmartFit Pro Trainer. And this is really, this adds a layer of gamification, and we would integrate that into everything else that we're doing. So we'll be right back. Stay tuned, and Dr. Dave will be back with the SmartFit Pro Trainer 2.
Welcome back. So Dr. Dave here again, if you have not been with us and you're just joining. So we're going to go through the SmartFit Pro Trainer 2. So another great piece of equipment. So again, from the physical therapy side of things, when we have athletes, we have tactical athletes, whoever it may be, we're trying to get back to high performance. We're trying to get back to specific sport. And so we want to move functionally. We want to have the body moving in multiple planes. We want to be mimicking sport environments and movements. And we want to, with patients, with athletes, you can be in rehab for a long time, or you can be training, and sometimes that can get monotonous. And so you want to create some fun with it. So this board definitely does that. But even outside of having this board, what we want to create that fun. We want to create that competition. We're working with athletes. So one thing we want to do to create that functional sport-specific type movement is we want to get them doing that. So we want to be running. We want to be moving laterally. We want to be catching and reacting to, catching a football, spiking a volleyball, throwing a baseball, something like that. and having them do sport-specific movements. So again, here we have this turf space. I may have a patient that's working back again from ACL, football player, and they may have to move side to side. So you might be doing some shuffling like this, and I might be throwing a ball to them, so they're catching the ball as they're moving. Or maybe they're backpedaling and then stopping, catching the ball, running their feet, and then turn and catch the ball. Those are all things that we can do that's going to get that athlete moving and doing sport-specific type activities without thinking about the injury that they've rehabbed from, the deficits that they've come back from, anything like that. We're making their performance and their movement automatic again. And so those are just simple things. There's really, your creativity is your limiter. You want to think what that athlete is going to do, and you want to try and mimic that. So with the SmartFit Pro Trainer, we can add another layer to that. So again, like some of the other Reaxing equipment, we can create that decision-making process, that reaction. We can throw a football at this, a baseball, hit a volleyball, whatever the case may be. We can use the board in that sense. Or we can have them working on a back pedal away from the board and then a stop and sprint to the board, find the target that they're supposed to hit, and then go back into that movement or change that movement. So much versatility here. So what we're going to do is I'm going to bring Jeremy up here in a second, and we're going to do basically a game on the board where he's going to be searching for multiples of 3. So all the targets are going to light up on the board, and they're all going to be scrambled. There's no real order. It's all randomized. And he's going to be going 3, 6, 9, all the way up through those multiples. But in process of that, to create more of that athletic functional movement, he's going to hit go on the board. He's going to run to this chain, to the Reaxer chain, and he's going to throw the chain out to each side, drop the chain, run back to the board, and find his target and hit that target. We're going to keep going. We're going to do a quick game of this, 30 seconds. So Jeremy, why don't you come on up so everything makes sense here with the game. So you're going to start right here, right in front of the ropes, hit go to start the game. You're going to run to the chain, throw the chain out, throw it here, set it back down, find your target.
Got it. By threes.
By threes, yes. So as you can see, that Reaxer chain is creating a transitional movement on his body. He's having to transition that to a sprint. While sprinting, he's locating his new target in the scrambled numbers. So then in his brain, he's calculating, okay, what's my next target? 3, 6. He's processing that and having to make a decision on where that is and which one he needs to hit. So it's a personal challenge, it's a athletic challenge, and time's up. So he got about 4 targets in 30 seconds. So we can gauge that. We can go by score, we can go by reaction time, accuracy. We can put a penalty on it. So if he were to skip a number, the board would not reset. It will buzz, and so he knows he has to find it. And so there's a challenge there, is as he's doing all these things, he's moving, his body's working, he may lose track of where he was. And so if he does that, or he thinks I got 12 and I'm looking for 15, well, he never hit 12. So he's going to lose points on that, or the game's not going to continue. So those are all things we can use this to track. Accuracy, decision-making, reaction time, all those pieces that are going to help us carry over or improve the training and performance of the athlete, while making it fun, and while, from a rehab standpoint, while challenging, maybe it's the knee and the lateral movement, the stability, the strength, acceleration, deceleration, change of direction, things like that. So the other nice part about this is this board, the Pro Trainer 2, we can split it. So if we have multiple athletes, we have a team, we can compete. So again, adding that other layer of challenge here, where you're not only processing your target, making a decision, performing a movement, all those different things, now you're competing. So now you have the stress of competition applied to the same game. A level of fun, but also another level of pressure, so you're making those decisions under a higher state of pressure. So we're going to bring John in, and John and Jeremy are going to compete. So I'm going to reset the board so they can compete against each other. But what they're going to do is they're going to take these small fluey balls, and these are filled with fluid, and they're going to take it in one hand, and they're going to tap the board with that ball.
I want the good one.
Okay, so they're going to start right here at the ropes. They're going to run to the wall and hit go. Once I tell them it's all ready to go.
We're counting by threes?
And we're still counting by threes. So when I tell them to go, they're going to run. They each have half of the board. They're going to find their target. And after each target, they're going to switch hands with the ball. So they're going to have to use left and right. And the ball itself has fluid in it, so it's creating a small amount of variation as they tap. Okay, guys, ready? Go when you're ready.
Wait. Oh, there
Nice.
it's 9. Dang it.
Very good. Five seconds. Time. Very good.
Oh, that was close.
45-40. So as you can see, we can look at their stats individually, their reaction times. They obviously get the challenge of the board and the activity, but the level of fun and pressure of the competition against each other, because they're actively kind of in channels here, moving with each other. So.
Awesome, thank you.
All right, so I'm going to turn it over to Jeremy here, and we'll kind of close up and finish up.
Yeah, awesome, thanks. So thanks, Dr. Dave. Again, super grateful for everybody joining us. And, you know, the idea of the highest level performance, that's what we're interested in, right? So obviously, reaxing is not the greatest end-all, be-all, unless it is. We have an opportunity to do some things differently than we've done in the past. And from a reaxing standpoint, from a reaxer chain fluey, we really have this broad opportunity now to challenge both cognitive and body in a unique way that allows for the highest level of performance. So if you're local to Colorado Springs, please, Dr. Dave Bush, Cadre Physical Therapy and Performance. If you're interested in training with John or any of his great trainers here at Total Body Works, please feel free to call John. Just call the main phone at Total Body Works. And if you're a trainer, if you're a coach, if you're not in Colorado Springs, but want to come down and train and utilize the Reaxing system, the SmartFit system, the Viper Pros, if you're interested in that, also feel free to reach out to John Marshall here at Total Body Works, and he can set that up. I mentioned earlier that we had one of our colleagues, Kadrick Bloomquist, he had the all-Navy, all-Marine wrestling teams come down for a camp, and we had a blast. The gamification, the challenge between each athlete, both from a wrestling standpoint, from a tactical standpoint, really gives us an opportunity to both, you know, create camaraderie and create team, but really allow them to experience both what their current dysfunction is, and then, you know, what they're really good at, and how do we as therapists and fitness professionals and coaches, how do we bridge that gap, right, to create the highest level. So again, thank you all so much for joining us today. Please reach out if you need anything, Reaxing North America, Total Body Works, or Cadre Physical Therapy and Performance.